Something people might be surprised to learn is that my dream job would be to be an anchor on ESPN. And I guess I kind of did a mini audition a few years ago when we lived in Alabama. I broadcast high school football and basketball games on the radio, and so I was kind of known as the voice of the Bulldogs. My name is Mark Dooley, and I'm the president and CEO at Wilson Memorial Hospital. Growing up, my father was a hospital CEO from the time I was in 3rd or 4th grade, and so grew up naturally around hospitals and healthcare. So I knew from an early age that I wanted to be involved in healthcare. So just kind of came by it naturally, following my father's footsteps and being around it my whole life. My favorite things really is my faith and my family. Those are the two things when people ask me what are important to me, what are the things that I kind of live for, is my faith and my family. My wife and I we have very strong faith, and I mentioned kind of the experiences over the years and going to different places. We've taken the approach that every place we go is a place that we're meant to be for that period of time, and we've taken positive experiences out of everywhere that we have been. And family, we have 5 children. They go from ages 13 to 23. So the last, however many years, 20-something years, most of our free time has been spent with the kids. So professionally, I started in hospitals in 1991. Did an internship actually at my father's hospital to kind of get my feet on the ground and figure out, yes, this is what I want to do. My first real job, I guess, as a hospital assistant administrator was in 1992 in North Carolina. I kind of took the opportunity over the next 5 to 10 years to do a lot of different jobs in different parts of the country, in different areas of healthcare, really to kind of just broaden my experience while I was still young. And so over the past 23 years, I've been a CEO for about 15 of those years. Been CEOs of acute care hospitals, obviously, like here at Wilson, but also of behavioral health hospitals and physical rehab hospitals. And so a lot of different varied experiences, and just something that I think each one of those experiences has taught me something new, something different. I think Wilson plays a very significant role in the community in several ways. Number one, as in most communities this size, the hospital is really the hub of the healthcare sector of the community. I think Wilson has a very key role, not just in taking care of those who are sick, but also in doing everything we can to make sure that the community is as healthy as it can possibly be. The second component of that, I think we have a very big responsibility as a corporate citizen. There are a lot of organizations in our community that rely on whether it's volunteer hours or monetary donations, things like that, to sustain themselves, that really have a significant impact on the community. And I think Wilson, as a large employer, as a key component in Shelby County and the surrounding areas, really plays a key role in that. I think the biggest thing that separates Wilson is it is rare in that it is still truly a community hospital. And by that I mean Wilson is still governed, managed. Any decision impacting the hospital is made here at the hospital and in this community's level. More often than not, hospitals now, and I've been at several of these hospitals, are part of larger systems. We're still able to do the things locally and make those decisions locally. Well, my favorite quote comes from John Wooden: "Don't let what you can't do interfere with what you can do." I think that's something I've used not only in my work life, but with my kids as well over the years. I think so many times that we get bogged down and focused on those obstacles and those things that are hindering us, the things that you can't do, things that you can't control, outside forces. So really, there's nothing you can do about that. Let's not focus on what we can't do, but what can we do? There are a couple things to me that I consider non-negotiable, things that we have to do well. First and foremost is we have to provide a high quality product for the people that come in here. So we have to make sure, and it's my job to make sure, that we have very competent staff working at the hospital, people that understand their job, understand how to take care of people to get them well. The other component that is really, really important to me is customer service. When people come into a hospital, more often than not, you're not getting them at their best, okay? Because if they had their choice, they would rather not be here. People come into a hospital, they expect the basics. You know how to start an IV, you know how to give shots. They expect those basic clinical things. What they're looking for is, how did you treat me as a person? And those are the things that we really need to focus on.